You had weight loss surgery maybe a year ago, and now you're wondering to yourself, how do I know that I'm in maintenance? Let's talk about it. Maintenance looks different for everybody. It really does. And it's oftentimes a feeling and also a decision that you make with your bariatric doctor. That's why it's really important to make sure that you do have somebody that you're working with. That means that if you had surgery in Mexico or somewhere, you find a local doctor to work with because they can help you assess what maintenance look like. For a lot of people, it's just a feeling or just seeing their weight slow down and then just kind of taper off, and that's where they want to be. And then for other people, they're like, nope, that I don't like that either. But please, as I always say, and I'm 17 years out, so I definitely know what maintenance looks like. You will bounce back about 10 to 15 pounds from your lowest weight for most people because it's just usually not sustainable how low you get in the initial weight loss. And your body just comes back to what's called a set weight point, where your body might not be like the thinnest that you've ever wanted, but it's just at a comfortable place where you don't really have to try very hard to lose weight. And that's what you have to ask yourself. Do I want to be at that really low weight where I'm always on the struggle bus? Or do I want to be at kind of like that almost there weight, but feeling good, and then maybe going and building up muscle and working with that maybe extra little bit of fat to do some body recomp. So that's kind of how I knew when I was at maintenance. Feel free to make a comment and tell me when you realized you were in maintenance.